you, Deborah.
Thanks so much. Again, it's Deborah. I use she and her pronouns. And I do work with Centrelink. For those of you who are unfamiliar with Centrelink, our mission is to strengthen, support, and connect the over 300 LGBT centers that are part of our network, most of which are in the United States, but also a good number in Canada and even some beyond. And one of the ways that we have been doing that recently through YouthLink is knowing that our centers are relatively small. We have worked in collaboration with other partners to develop some digital tools that our centers can use, but anybody can use, because the real purpose is to help LGBTQ youth. But of course, it helps our centers and all of you help LGBTQ youth as well. So I'm very happy to be sharing this with you, and I welcome you to ask questions throughout. It's not a lot of us. It's totally great to ask questions, but I also really welcome you to make this your own. It was developed with many other organizations, maybe not yours exactly, but definitely one like yours. And this tool is really intended. It's a collaboration between Hope Lab, I'll talk more about, Centrelink, and the It Gets Better project. It's really meant to be something that we all use. So I know sometimes it's hard to sort of take something on, you think, oh, I'm promoting someone else's thing, but ultimately this is owned by all of us on behalf of LGBTQ youth. So ultimately the point, right, of this thing is to make you feel comfortable enough to say, like, this is mine. I do want to share this with LGBTQ youth. So ask all the questions that you have. I will talk briefly about our other digital tool, which is older and less exciting, but we need to get the word out. Less exciting because it's older, equally exciting. I'm going to share my screen because I do have a deck. Make sure that you can all see that, and you don't see the chat that I have open and things like that, do you? Okay, great. So let me move the chat though, because it's blocking my view. So we're going to talk about IME. It's a research-backed mental health tool built for and with LGBTQ plus teens. No, that's not going to work. There we go. We already did some introductions, so I'm going to keep moving. As I mentioned, this has been a partnership. It was created by Hope Lab. And Hope Lab, if you're not familiar with them, which some people are not, they are a social innovation lab that are advancing digital health solutions that support and empower young people, especially those from historically excluded communities. I imagine you all know It Gets Better project, and I've already introduced Centrelink. So currently Centrelink, quote unquote, owns and manages IME, but it is really something for all of us to use to support youth. Ooh, there we go. So ultimately, I'm confident that you already know that LGBTQ youth need mental health support. That's why you're here. So I'm not going to go through statistics or anything like that. And it's due to the stress imposed by the stigma and the discrimination that they experience. They're more likely to report being depressed and to consider suicide, etc. And the situation is harder, as you, of course, know as well, for those who have additional minority identities. But fortunately, most youth do have access to the internet, and they're turning to it for support already. But there's limited research on how to effectively provide mental health support online. So what we did with IME is we really looked to the evidence from face-to-face interventions that suggest that affirming their identities and teaching them skills for coping with stigma and discrimination and providing community support would really improve the mental health of those teens. And this is what we leveraged in order to build IME. We also really leveraged youth themselves. We co-designed with over 350 youth since the project launched in early 2020, the majority of whom did identify as racial and/or ethnic minorities. And we really wanted to make sure that it spoke to their needs and not what we thought their needs were, or more importantly, in a format that wouldn't work for them. Out of that came IME. It wasn't the first name, but we eventually landed on IME. The idea, as a way of remembering, is like, I'm me. And the logo, there's a word for a visual pentagram that I cannot ever remember. But ultimately, no matter how you turn it and change it, IME will still look like itself. And that's really what we know, that youth are at the core strong and have what they need, and we just need to support them get to where they want to be. And we do that by exploring and affirming their identity, helping them learn practical ways to cope with the sexual and gender minority stress that they're experiencing, and do that in ways that are helpful, relevant, inclusive, and joyful. The I'm going to show you more about the tool, but you can see here there are 4 content areas: coping with minority stress, exploring and affirming their intersectional queer identities, coping with stigma, and then exploring their gender identity. And each guide incorporates what we know about what works to support the mental health. So we're giving them places to explore their identity and affirm it. We're giving them places and activities that are interactive to really ensure that they can acquire coping skills. And we're really giving them an opportunity to at least hear and read the voices of other LGBTQ teens, to know that they're not alone, that they're part of a community. So I'm going to unshare my screen for a second and go to IME Guide. I actually do need to go to it. I will tell you about one of the features right away, which is that it times out after 10 minutes. It's a safety feature, but what it means is I can never pull it up beforehand because it's disappeared already by the time I start talking. So let me share my screen again and show you the guide. I'm going to open it a little wider. It is designed to work on both mobile and desktop. Of course, we're talking about teens here, so we're going to make sure it's mobile, but I'm going to show it to you on desktop just to make it a little bit easier to see more of it. So as you see, the 4 guides, those 4 topics are at the forefront of this. And in addition, we know that youth will explore it at their own pace. So it's a little bit of a choose your own adventure. And so we also, at the bottom here, you can see, have a feature by which they can share their phone number with us, which is protected, and get some mental health boosts. It's over 28 days that they'll receive a series of texts every other day that lead them to new content within each time. So just to give, I'm definitely encourage you to explore yourself, but to give you a sense of the kinds of interactive activities, I'm going to look at the stress guide first. So there are activities, things that are more focused on learning, things that really introduce them to community. As you can see at the top, those icons represent different kinds of activities. The artwork as well is a really key piece of it, and we've had youth respond very positively. We work with queer artists, designers, and illustrators, many of whom are young people themselves, and they developed the artwork and the visual design of the entire web app. And youth were also key in testing to make sure that it felt relevant to particularly to QT, BIPOC, queer, trans, Black, Indigenous, and other people of color. So that's very much represented in the artwork and the artists that we involved. To show you about the community piece, I'll jump in this one. So this module is about you're not alone, stress is real, lots of folks experience it. Most of the modules have a video of a young person who's saying what's also here so that people can hear and see a young person who identifies as queer. And then we have a number of audio stories in this section. In other places, there are images of the young person and what they had to say about themselves. But ultimately, there's a lot of content that really exposes them to a diverse group of other queer youth. Going to go to show you another aspect of the choose your own adventure is they can continue in the stress guide by going to the next stress module, or they can jump around and really explore more about other topics. And yet also reminded they can get texts from us. So they can just going to, come to us in whatever way works for them. In terms of showing another aspect of the interactivity, there are over 20 of modules that contain what I'm about to show you. So this one's asking you to reflect on their current identity. And a lot of web content exists that's like, think about your identity. But we have intentionally used these interactive conversational pieces where we're asking you to think about what's your identity been influenced by? And this goes through a text-based chatbot sort of like conversation that really enables the kind of reflective thinking that we know helps anybody, but youth in particular, move from point A to point B and then point C along their own journey. So we have over 20 of these throughout. Next, I'll show you one for that's in the gender. We have a few of these that really use approach youth in a variety of ways. So reflecting on their own gender journey. In this case, you see again, there's a voice from a young person about their own gender journey. But then young people can, this is actually my drawing, can draw their gender journey, download it for themselves. They can come back. The heart was there because I had done a heart before, as well as see the gender journey drawn by other teens and hear what those teens had to say about their own gender journey. So really using the multiple intelligences or the different ways of that we think about things, and drawing is a piece in a variety of the modules as well. It's definitely worth exploring. There's over 50 modules, so definitely I'm not going to show you them all, but just giving you a sense of really how this is much more than just a website. It's very interactive and really helps you explore and get support that they need. There is, of course, also, so it doesn't show up well in the white. Let me go back to the home page. For youth who might just be like, wait, what's asexual? There's the content around LGBTQ 101s. And then there's also content that helps them find crisis resources, their local LGBT center, or other resources as well. In addition, there's a saving feature. So any page the young person feels particularly great about, so I'll jump to a new one. Here's another one with these interactive conversations. They can save it, and then it will be on their saved page. So they can come back to the modules that mean the most to them. There's a number of modules that have meditation strategies. There's some with Spotify lists to help relax. That's in the stress module. And so this really enables them to find what they might have not been able to find. That said, there's also a guide map at the bottom, which is helpful for those of us who might want to use it for multiple. You can, as the youth can use this on their own, but the guide map really helps us when we want to do something maybe in a classroom and use this tool as well. The other thing that I wanted to point out before I stop with this is the safety features. So in addition to the 10-minute timeout that I just described at the very beginning, reason why I can't ever have it up before, it times out and goes to Google. And then there's also a quick exit, because we know, unfortunately, that many youth may not be in a position where it feels safe to be exploring their gender or sexual orientation identity. And those two features really give them the space to potentially to keep it to themselves in the meantime. Is there anything that anybody saw that you want me to click on? You're also welcome to go. It's ime.guide. It's a very easy, so you're welcome to go there yourself and explore, but I'm also happy to answer any questions before I go back to the slide deck. Okay. I'm sorry if you hear my cat crying. They're just back from the vet. Obviously, I didn't bring them, but let me go back to my deck.
Deborah, I didn't know about that feature where it automatically goes to Google. That's so smart. So if you walk away from your computer and another family member comes to that same, family computer, they're not worried. Exactly. Oh, I left it up.
Exactly. And it's also good for you if you're exploring and doing something with it and you're like, wait, I had that tab open, that you should know that it happens. That's happened to me many times, even though I know it's going to happen. So one of the things we're working with Hope Lab really enabled us to do, let me move this back to the slideshow, really enabled us to do was run a randomized controlled trial to see the impact of using IME. So we did actually have 270 teens participate who are on average 16 and a half. Over 3/4 of them identify as BIPOC, and 60% identify as a gender other than cis, and did come from a lot of states in the US. We only did use youth in the US. We did make sure that BIPOC and youth who were not cis were overrepresented, because we wanted to make sure that those teens, that we could really generalize the result to those teens as well. The teens were then randomly assigned to the experimental or the control group. Those in the experimental group received all of what you saw with access to those 4 guides, plus the link to freely available resources. The half in the control group got only those links. It was beautifully designed, had similar artwork, but only had the LGBTQ 101s and the resource lists. Both were able to freely interact with them for a total of 4 weeks, and we did a baseline and a 4-week survey. At the 4-week survey, we did see that those who had received IME were more confident in their ability to cope with stress by the end of the study than those who were in the control, as shown in this figure. And they reported significantly greater increases in adaptive coping strategies, such as seeking support from other people, positively reframing the stressors they were experiencing, and dealing with stress by trying to come up with a plan for what to do. So we were very pleased with these results, and we felt affirmed that everything we poured into it and looking at what we knew worked, and getting youth to really, all those ingredients really paid off to create the recipe that we intended. The other thing to know is that participants, not surprisingly, but they liked IME more than the control web app. And these quotes really demonstrate that. An 18-year-old Latinx male from Connecticut said, "I found IME both informative and affirming. I think that learning about others who've had similar experiences with their sexuality is a great way to come to terms with one's own sexuality, and the stories and activities on IME help to facilitate this. I would certainly recommend it to other LGBTQ+ teens struggling with their identities." And a 15-year-old Black female from Ohio said, "Before IME, I was questioning whether I was bisexual or pan, and I felt the need to put a label on it. After IME, I realized that it's okay to not label anything and not have a label at all." So it's been launched on June 1st. Actually, when I put this slide deck together last week, it was at 32,000. Now we're almost at 33,000 users so far of IME. But we really do want as many youth as possible to make use of it. So we invite you to spread the word. You can download materials and it's right there on the website /spread the word. You're also welcome to follow us or repost things from us on Instagram and Facebook. Facebook's for the adults, Instagram's for the younger people. And as well, if you're interested, I can also send you printed materials. We have wallet cards and sticker sheets that we can send out that have a QR code on them. So that's IME. Before I move on to tell you just 2 slides worth of Q chat space, I wanted to see if you have any questions. Okay.
I have a question.
Yeah.
Are you seeing or hearing of any organizations who are kind of bridging this online tool with any in-person activities?
That's an excellent question. I actually am working on a workshop to help people do that.
Oh, cool.
For CentralLink members, because I think it's very usable. Because we know, again, that the right ingredients are in there, that this is hitting on those things that research really shows will help youth. They can definitely be used. I think anybody who's put together a lesson plan could do it pretty easily. The gender journey one. Let's everybody do the gender journey. You're doing it on your phone or your device. Okay, anybody want to share their gender journey? Want to talk about it? What was it like to do? You come up with a series of debrief questions and you have a great discussion about gender journey. I think any of those could be used for activities in-person activities or for virtual support, but asynchronous group support, like if everybody's on Discord together or some other channel. So I do think it's very, very applicable in many different situations.
Awesome. And at the beginning, you were sharing how this is kind of a tool that was informed by so many youth and organizations. Are there ways for organizations, I'm thinking, Caitlin, of you and your expertise with family support, is this an evolving tool? Do you see this as something that content could be added to over time?
It definitely, there is the possibility for that. We did feel fortunate that we felt like we hit on the major topics, but we have the capacity, and I actually have the capacity. It's on Squarespace. Hope Lab did a great job of making it very accessible for us, CentralLink, who has limited resources. I'm able to make edits. So even already we've had youth, you can contact us through the website, and youth have said things like, the way that you worded the definition of asexual didn't quite jive with we're responsive. So we're able to make small changes as well as potentially add additional modules or remove modules if they become, out of date in any way. Yeah.
Thank
And
you.
happy to talk to people about potential collaborations or using the content. Ultimately, no territorialness. It's all about helping youth. Okay. So I would be remiss if I didn't mention Q Chat Space, because the reason why we even partnered with Hope Lab was because of what we were seeing with Q Chat Space. So for the next 2 slides, I'll briefly talk to you about Q Chat Space, which is a community for LGBTQ teens, through which we provide live chat support groups. So everybody's typing, there's no video or audio. It's for teens 13 to 19. It's all synchronous. There's pre-scheduled times. You see an example of the schedule from earlier this year on the slide. And all the chats, they last an hour and a half, and they're facilitated by trained staff and volunteers from LGBTQ youth centers across the US. And the reason why we partnered with Hope Lab to develop what eventually became IME is because we realized that we had youth coming to us when a chat wasn't happening or wasn't going to be happening for maybe a day. And as we know, when a youth is exploring and needing something in the moment, and if he has the courage to, and the time, the space, and the privacy, we wanted to be able to give them something at that point. And so we were exploring possibilities. We have a page of resources, but it's a page of more links. And so this interactive tool that Hope Lab built really fit that bill. So this doesn't show it, but if there's not a chat happening within 4 hours, the first top left box actually says, and which at this time of day, you could actually go to qchatspace.org yourself and see it. It says, sorry, there's no chat happening soon, but check out IME. So it's integrated in that way. In IME, when there's talk about community, Q Chat Space is a referral. So, and then in addition, at the 24-hour, you can set up text reminders for chats, and at the 24-hour text reminder, you get one at 24 hours and one at 1 hour before the chat, it says, hey, while you wait, check out IME. So we are really trying to support youth outside of the times that they might join chats. So Q Chat Space also is a collaboration between Centrelink, the Planned Parenthood Federation of America, and PFLAG National. We launched a pilot in 2018. It went national in 2019. And ultimately, the goals are really to provide support for teens who can't come to in-person. It's very similar to in-person chats that might happen in an LGBT center or one of your organizations. We have introductions, we have group agreements, there's a topic, there are questions around that topic, activities. We've seen some amazing games of guess the movie I'm talking about by the emojis I use. So it's a really fun space for youth. And ultimately, it's meant to help them feel less isolated and really to help them develop a positive sense of their LGBTQ identity. We do have specific chats for subpopulations. We have a Spanish chat on Monday nights. There's a chat weekly for trans and non-binary youth, a chat weekly for youth of color, and generally twice a month for asexual and aromantic youth, and another one for bisexual and pansexual youth twice a month. And every topic you can imagine that LGBTQ youth want to talk about, as well as not on the topic because they're teens and they talk about what they want to talk about. But it's a great fun space for youth to get support and feel that community. And it's a good partnership with IME in that it really supports youth around the clock. So I'm happy to answer any questions, hear any ideas you have for collaborations, and you're always welcome to reach out to me as well through IME, through Q Chat Space, through my direct email. Happy to chat.